Good afternoon, good morning, wherever you are joining us from across Canada. We're really excited to do this webinar as we wrap up 2024. I think we're all shocked it's already December 10th and we're a couple weeks out from 2025. So with that in mind, I want to just do a little bit of housekeeping and we can get going and walk through some interesting stuff. So next slide, please, Haley. And you'll hear us calling Haley. Haley is on our comms team on the back end supporting us. So thanks, Haley, for doing this. But joining us on video today is myself, Peter Query. I'm a principal here at Santis Health. I've spent a lot of time working in governments, provincially, federally, and if I don't know you and you've joined this webinar, it's a pleasure to have you here today. And for those that I do know, thanks for joining. I'm joined by two outstanding and awesome colleagues. I think the key is to surround yourself with smarter people, and on that point, we've had a resounding success. So Michelle McLean is working with us up here in Ottawa and has spent, I think you started in public affairs and consulting when you were in your teens. So your 20 years of consulting experience has worn well, and we're really thrilled to have your insights here today. And then Tyler Shandro, who is not just a health minister to the province of Alberta, but the health minister during a pandemic, which is a different task altogether. On top of a practicing lawyer and supporting healthcare organizations in his spare time, whether that be Covenant Health. And we're really pleased that Tyler has decided that he wanted to continue working in the healthcare space outside of his time being a lawyer. So we're really pleased to have him working with us and have you here today. So thank you, Tyler. A little bit of housekeeping. There is a Q&A button in the webinar Zoom window here. Anyway, do all your questions in the Q&A. It allows us to see them. We can answer them live verbally. We can answer them in writing. And then we'll also be able to see them. So that way, if we don't get to them, we're happy to follow up with you after this webinar. We will be sharing the slides. They'll be sent out afterwards. So you're more than welcome to leverage them. And then we will be sending around a survey to make sure that we can continuously improve these experiences for all of you that have so kindly attended and taken time out of your day today to do that. So with that being said, let's get rolling. Our team here is really thrilled to be able to provide exceptional advice to the healthcare sector. We do that through not just government relations and advocacy, but also a lot of strategic development and management consulting and leveraging the exceptional capabilities we have with our communications team that does a lot of stakeholder engagement as well too. These wraparound supports have allowed us to be able to support clients from across the country with a footprint that exists from BC all the way to Atlantic Canada. And we're really thrilled to have many of you on here today that have been part of our really awesome journey and growth that we want to continue to do an exceptional way to make sure that we're providing high quality advice to you as you're trying to meet your objectives. And with that in mind, we wanted to do a deep dive today on what's going on federally and what you need to be thinking of over the next 12 months. And we usually like to start that on the next slide with a bit of an overview of what is the polling telling us. And it's a pretty straightforward story by looking at this chart. Conservatives are up, Liberals are down, NDP are relatively stagnant from where they had been in the past. We've done these webinars in 2019 and 2021, and at that time we were saying, what's the desire for change? Because that's the number you're usually looking for when you're looking at an incumbent government going in. Is the desire for change high? Are people going to flip the switch on that? And in 2019, it didn't seem like it. In 2021, it kind of started seeing. It's clear now that desire for change has hit hard, and that is the reality of any government that's been in for as long as this government has been in. I believe Prime Minister Trudeau is the 7th longest serving prime minister, just behind Stephen Harper, and he'll eclipse Stephen Harper if he gets through to the spring. And that's wearing on the population. And it's starting to show these polling results in by-elections. The Liberals have lost 3 of the by-elections that they've, I believe, hoped to have been relatively competitive in over the last year. There's another one on December 16th. By all accounts, it looks like the Conservatives are projected to take a majority vote in a previously liberally held riding. The Conservatives are leading in all regions across the country except for Quebec, where the Bloc Québécois hold a comfortable lead. And the number of Canadians that are dissatisfied with the Prime Minister is extraordinarily high. And to even go further, when you look at the polling that was done by Abacus on a riding by riding basis, if you look at Liberal ridings, a majority of the people in Liberal ridings want the Prime Minister to step down and encourage their MP to encourage him to step down. Um, these numbers don't tell the whole story. It doesn't mean everything's rosy for everybody else. There's obviously some soft vote on leadership numbers and who people might want to see as prime minister. So that all does exist, but I would argue that these bigger numbers are probably eclipsing the relevance of those. I think the Liberals are hoping that they can capitalize on some soft numbers. I think I think it's a Hail Mary. It's a tall order given the numbers we're looking at today. If we look at the next slide, when we start digging into particular issues, the Conservatives are building a strong lead on an issue by issue basis. They've had a couple elections where they haven't won and they want to win, and they're not going to leave any stone unturned. They're going to make sure that any issue that another party has a reasonable amount of support on, they're going to want to capitalize that on that and make room for themselves in there. So I would expect that this is a party that would want to make sure that the NDP and Liberal combined support on a particular issue, that they work away at that. I think if you were a Conservative campaigner right now, you would look at this and say, I want more support for the Conservatives on a lot of these issues, in spite of the fact that they have a dominant amount of support on the big issues of the day, whether it be the economy, whether it be immigration, and then some more interesting ones that have really seeped into the mindset of the country since COVID, especially around political correctness and this idea of freedom and a lack of freedom in Canada, which is a feeling that I think will come out in a number of narratives and messages, and we've seen it in some Conservative ads already. I'm not sure there's a lot of bright hopes in here if you're a opposition party. I think the NDP are probably enjoying the fact that they're punching at the same weight on a lot of these issues as the Liberals. There's not a lot of numbers in here that would make the Liberals feel good. And there has been some other polling, and I'm sorry it's not in this one because this was a more recent poll, and it says July 5th, but I believe we actually swapped this out for the December 4th one. So I apologize. We'll correct that before this is circulated around. And there are some polls around who's most competitive against Trump, and the Liberals do hold a slight edge there, but I don't think it's anything to take home to the bank from a party standpoint. So I think with that being said, I'm going to pass it over to Michelle to start thinking through, well, what are the parties focused on today? So I'll pass it over to you, Michelle.
Great. Thanks, Peter. I think the other thing that the Liberals are worried about, they don't have a shortage of worries, is if you look at the fall polling, it showed that the soft vote, the vote change, was moving to the Conservatives and not to the NDP. So both the NDP and the Liberals will be looking at that, but that's the wrong direction. To your point, they split some of the support on healthcare, but when you see the vote switchers, they're going Conservative. So Haley, next slide, we can think about that. The other indicator, of where the Liberals are and what they're focused on is they're trailing the Conservatives in the female vote. And that's a huge indicator. Traditionally, as many of you know, the female vote turns out for the Liberal Party, well, they're behind the Conservatives 2-1 with the female vote. So there's a lot for the Liberals to focus on in terms of election readiness. But you've seen, frankly, the government on its back foot, delaying the fall economic statement, now scheduled for Monday. And apparently we'll see a much larger deficit than has been forecasted. So not good news for the party. And today you will see in the headlines tension between the finance and the Prime Minister's office. So internally, I think we can see a lot of that pressure that the polling is creating on the party. We haven't seen a cabinet shuffle. They've got to do that. They have 2 ministers that are carrying 2 portfolios. 5 have announced that they're not running again. So it's clear that a lot of this delay is frankly to keep one would think, their caucus in check and tamp down on a lot of that public scrutiny that we saw several months ago, calling for the Prime Minister to step aside. So the Liberals have a lot to get in order in short order before the election. Now, the NDP certainly ended the supply agreement, but they haven't stopped supporting the government. In fact, indicate they'll support government before legislation is even tabled. But so the real question there is, when will they pull their support from government? But they're not ready. So there are very few people that think that's going to happen in the short term. They have less than a quarter of their candidates nominated. They're not ready to go to an election. And I'm told that within caucus, the debate is really whether they pull their support for the government at the time the budget is tabled, or should they go all the way to October. So again, a fast snap election is not in the cards, at least from the NDP point of view. And then Haley, next slide. The Bloc, as Peter said off the top, pulling very strongly in Quebec. So they're in a good position no matter when the election is called. They asked or demanded that the government support two measures they put forward. The government hasn't and has continued to rely on the NDP for support, and the NDP have been there. In terms of the Green Party of Canada, it's still the Elizabeth May show. There hasn't been a lot of change in leadership that allows them to introduce a new narrative. And if you look closely at the polling, climate change has dropped 5 points since June. So that means that growing the vote share for the Green Party is going to be very, very difficult. So that's a quick snapshot at where the parties are focused or where they stand now. And we'll go over to Tyler to dig into the Conservatives.
Thanks, Michelle. And thanks, Haley, for switching to the next slide. I think it's really interesting to talk about today's Conservative Party for a number of reasons. I mean, one is, you see in that first bullet, the focus narrative is really interesting. They want to axe the tax, they want to fix the budget, they want to stop the crime. But outside of that focus narrative, other than looking at the past Harper government or some of the policy declarations of the party, the members of the party, we don't really know outside of that focus narrative. And because of the influence of populism, there's a bit of a wild card. We don't know to the extent that we will see that populism influencing not just a Poilievre as a leader or that caucus. And so we don't know when we get to a certain issue. I think we have to acknowledge that there is a bit of a wild card because of the influence of populism. When I hear Pierre speak publicly, I find it remarkable how often he is remarkably different in some ways than Harper on certain issues. And sometimes the tide is turning in how the boundaries of certain of ideology for certain issues is changing because of that influence of populism. We do know that conservative fiscal policy, though, capping government spending, reducing inflation, I think there's a real for conservatives. They believe that inflation has been heavily affected or caused by increased spending over the last few years. So there's going to be the pressure for the reduction of inflation to occur is going to be in reducing government spending. There is a huge mistrust of federal public service, going back again to the influence of populism. I think a big part of populism throughout not just North America and Europe, but throughout the world is an undermining of the trust that people have in institutions. And I think that's happening in Canada as well. And then just a little bit of a comment about the policy declarations. As I mentioned, we don't know a little bit about what the government may think because of the policy declarations of the members. So there's been a focus on palliative care. I think that when it comes to MAID, I think there's going to be a return to the Jody Wilson-Raybould legislation and going back to those boundaries. mental health is going to, and addiction is going to be a very big influence or a concentration of this of Pierre Poilievre government. I think there's going to be a very big focus on moving away from harm reduction and including recovery and recovery-oriented systems of care. Yeah, with that, onto the next slide then, Haley. And then looking back at the Harper government, well, I think there's going to be a big influence. A lot of the folks who are involved in the Harper government are still going to have an influence in a Poilievre government. And a lot of those folks are saying there should be more for the money that's provided to the provinces, more strings attached, and maybe even more of a focus on wait time guarantees or any type of a guarantee, especially for scheduled surgeries. I think that's going to be interesting. Even though the Harper government kept the Martin government's 6% escalator, I think we can say goodbye to that. I think we're probably going to be looking at a 3% or nominal GDP increase. Peter, I think you were going to talk about the PCHOs. Over to you.
Yeah, I think when we look at the policies of the Harper government, the mechanisms that they use to support provincial and territorial health outcomes, it's largely the same between the Liberals and the Conservatives, and we'll contrast that a bit, and that's why when we look at the wait time guarantee, that's something that Harper government did earlier in the tenure. The bilateral health agreements, that's a safe template that was used. I think there's some differences in practice, but as a mechanism, it's relatively similar. On the up until very recently, the Liberal government followed the direction that the Harper government set on reducing the Canada Health Transfer, and in fact used a lot of that additional revenue for bilateral health agreements. But I think the interesting thing for PCHOs is this expansion of support for provinces and territories. And I'm not sure actually I'm the best one to speak to it because Michelle, you were there at the time and you actually helped set up MHCC. So I might just pass to you for a quick moment there.
Well, I actually worked at the Mental Health Commission and helped to set up the Canadian Partnership Against Cancer, but point taken, Peter. And I think there's a lot of lessons to be learned about that. And it was a real vote of confidence that the Harper government had in the expertise that sat in the stakeholder community. And I think that characterized their view, probably on all departments, but certainly health. And I think there are lessons to learn for this transition to a new government under Poilievre, is this strong conviction that the department doesn't have all the answers and that stakeholders need to inform policy development. These were the vehicles to bring subject matter experts outside of government closer to policy making. And they felt strongly that would benefit the provinces, but the public policy that was coming out of Ottawa. And I will say that the departments weren't in favor of that model. And I don't know that the Liberals, they didn't change it, but I don't know that they were ever big supporters of having that strong policy function sit outside of government. But it really was a testament to the conservative approach to building public policy with stakeholders, not for stakeholders. And they cherry picked where they wanted to have their impact, right? So they picked mental health, they picked cancer, picked cardiovascular disease, and some others. So it's this notion that the Conservatives don't do anything on health, I think, is a misnomer. I think they do, but they come at it in a very targeted way.
Well, a good example, I'm glad you brought that up, because a good example would be, under the Harper Conservatives, they were actively, there to set up PCHOs that help support provincial health systems. It was actually the Trudeau government, I think it was announced when I was there, but I don't want to take ownership of it because I can't, was actually did a review of the PCHOs,
Oh, yes.
the exact opposite. And I think at that time it was questioning, what is the value that the federal government is getting from $500 million that is being spent outside of the departmental system. And I think there is a lot of value for the work that High and some of these other PCHOs continue to do. And it will be interesting to see how a new government will reflect on that. And I think there's some choices that a new government will likely make. But looking back, I think we can see there's been a very different approach. And not just on PCHOs. We wanted to mention the advisory panel for healthcare innovation that was chaired by Dr. Naylor, and Marcel Saunier on our team was a leader on, and then David Clements, who I know is listening, also does some work with us, and he was also on that as well too. And I was very, very happy to work with Dave when we worked for Jane. But this report was probably not a report that you would expect to come out of a conservative government. And I think it's fair to say there was probably some resistance at the time to this report being released, but it's still something that is a live document today that has been the catalyst to a lot of different thinking about how the federal government can do things differently to support provincial and territorial health outcomes. I also think that it's an interesting report because if you dig into it, it's long. There are some things that even this current Liberal government has gone completely not against, but they have not followed the advice of this report. The pharmacare section in that report is particularly interesting that I call attention to. But my point is that there were a number of things that this conservative government did that I think there's a perception that it actually would be a Liberal government that would have done it. And I think that there's perception and reality differences that we really wanted to drive home here. The other thing that we reflect on often when we think about how a conservative government approaches health policy, and I think this is important to keep in mind as you're thinking about how might you approach your issues. They're far more focused on modest strategic initiatives that are constrained in a 4-year cycle that can be explained clearly to constituents what the outcomes were for that federal intervention. So that's why when you look at some of the reports they did that Kelly Leach actually did on healthy children and youth, you can draw some direct connection between those reports and some tangible outcomes. When you look at the fitness tax credit, when you look at targeted investment for brain health research for internationally educated health professionals, which they did pour money into at the time, lots of work on disorder and disease-specific initiatives. Autism and cancer are but two, but there are a number of them. And there was a very large effort around public health data systems, HPV vaccine funding, domestic flu vaccine production, and internationally, the Harper government really focused on immunization, particularly for children across the globe. They poured billions into that initiative. One thing that we did want to call out, and thanks to Marcel for flagging this before we did this presentation, was the big focus of the Harper government at the time of boosting up and supporting Health Canada regulation from a health and safety standpoint. Boosting up health products and food branch to make sure that they are operating in an efficient manner, speedy, that the regulations are advancing, that they were being responsive to the products and devices that are coming onto the market. That was a huge focus of the Harper regime. And you might wonder if there's a need for that refocus again right now, and in order to give our institutions the capacities to respond to the needs of the market today, whether that's sufficient capacity to work through market authorizations, whether that's sufficient capacity to assess different devices and products. It's something that is live in the back of our minds that we're watching, because that was a big effort that was done in the pre-2015 era. But if we flip to the next slide, and I welcome Michelle and Tyler to jump in here as we start thinking about the differences between the governments. Why don't I first flip to you, Michelle, because you were quite close to this first transition from Martin to Harper and to Trudeau.
Yeah, I spoke a little bit about it, but during that transition, I think what struck me was how open the government was to new ideas. I think it reflected an openness that Prime Minister Harper wasn't well known for. The party wasn't thought to be that way, but in that transition, they were really wanting to hear from stakeholders and not just the department. Now, that of course reflects the time it takes to build trust between a new government and the civil service. But the level of openness, I think, should be encouraging. And I know many people on this call are feeling that the Conservative Party is hard to reach at the moment because they are so focused on the election. But once in power, I was surprised at the level of openness and collaboration they were willing to have with external partners. And I think that was the hallmark of the first few years. And they weren't as risk averse, I would argue, as maybe the previous Liberal government had been.
I think we did want to do a call out to some things like funding arrangements. I think there's a perception that the funding arrangements between the Liberals and the provinces over the last number of years intervened in provincial jurisdiction. I think if you look at the wording of the agreements, provinces have clear autonomy to do what they wish with the dollars. But I think it's a worthwhile call out that the arrangements that this Liberal government had with provinces and the arrangements that the Harper, excuse me, government had with provinces, the Liberal agreements had far more detail to try and constrain it while respecting PT autonomy. And I think it's fair to say that there won't be the same amount of detail in any arrangement, if there's any arrangement outside of the Canada Health transfer, with this with a new Conservative government, if that does come to pass. I think the one thing I'd say on bilateral agreements, and the rest, we'll probably hit on this in the presentation, so I hope I'm not taking anybody else's speaking notes. The government of the day will be compelled to respond to system pressures, to health system pressures. Every government has been, and as we face that as a country and as individual provinces, depending the context and what premiers are saying and what is happening on a day-to-day basis in the system, a government may be compelled to act in a way that they might not be contemplating right now. The last couple points, and Tyler already mentioned mental health and addiction, so I'm going to leave that one there. I think all governments are probably guilty of the same thing, where you contract reports, whether the Liberals report on the Pan-Canadian Health Organizations or the Conservatives on the Dr. Naylor report. It's easy to contract a report and pick the recommendation that suits with your government agenda. So it's just a good reminder to all of us that regardless of the evidence and the recommendations we have, you have to meet the government where they are. And I think we've already talked on global. So is there anything else, Tyler? I saw you're off mute. Is there anything you want to jump in on this one?
Well, maybe this is good to answer Michael Law's question I see in the Q&A, and he's talking about the bilateral agreements just because you were talking about it. He's asking about Alberta being the third province to sign on the bilateral for drugs for rare diseases. And what do you think is at play here? How do you see other provinces moving forward over the next few months on drugs? And so maybe just to address that while we're on the slide. And I think what's at play here is, as you pointed out, Peter, that the government of the day is going to meet the pressures as they come. And right now, drugs for rare diseases and therapies for rare diseases are top of mind. And so I think it's a matter of the provinces. I think that look, for me as a formal health minister provincially, I always felt the pressure from the federal government to try and go further with bilateral agreements. I think the provinces are always going to push for, look, we just want your money. And if you want an agreement and you want to target it, and you want to suspend that money on this certain area, I think, in particular, Alberta, we've been worried for the last couple of years about the increasing costs for drugs for rare diseases. I think the lack of resources that the PCPA has to be able to tackle that as an issue. The extent to which you, as a province, want to follow CADTH recommendations. So for a province to be able to take that money and be able to spend it on increased spending for those drugs and those therapies, I mean, Michael, you're asking, well, how do you see other provinces moving forward? I think they're going to be moving forward because they're going to feel the same pressures with those drugs and those therapies moving forward, in particular as more patients or more families are going to be having loved ones suffering from whether it's SMA or whether it's cystic fibrosis. They're going to feel those pressures. And I don't know, do you have anything else to say? Because I know, Peter, you in particular have been working on drugs for rare diseases.
Yeah, and I don't want to get into the weeds and bore everybody too much, but it's a very interesting space, and one of the folks that works on our team and advises former ADM at Health Canada was articulating to us that the federal government's announcement that they would support drugs for rare disease in 2019, that was a reflection, that was a milestone moment in the same way when the federal government started taking proactive policy on AMR that says there's been a market failure and there's a role for the federal government to resolve for that market failure. That doesn't mean that that's a permanent position of the federal government. The government can change their tune on that, and a different government can change the tune on that. But where we sit right now is a federal government that now has to navigate and think about how do they solve for a market failure in drugs for diseases. Canada is a very unique country where we have the healthcare system that provides the ability for individuals to be diagnosed with a rare disease and an ability for the system to be able to treat the rare disease. There are not many nations that have that structure set up. It's extraordinarily expensive, but it's something that is being highlighted as a need of systems. And regardless of what happens in one province, if you can access something in one province, surely over time there's going to be enough political pressure that you're going to want to be able to access it in another province. That's just how it works. So now we're in the situation where, in the long term, the system of the Canadian system that supports market authorization and listing for drugs, they have a lot of really challenging things to think through, much of which they're not going to be solved by Canada alone. There's a lot of global work that's going on in the space, and increasingly, I think you'll see Canadian institutions looking to figure out what other regulators are doing on these more complex drugs, and what sort of review has been done in other jurisdictions that can be leveraged. Similar to the database to figure out what is actually going to work. What is the evidence that is valid that we can think about using in making determinations about the safety, efficacy, and the reasonable cost for a particular drug for rare disease or an orphan drug. That's not something Canada's probably going to get to on its own, and I think it's going to be a longer road than I think anybody would probably like. But not only do we need to figure out what the right evidence is, we need to figure out how to deploy that evidence in decision-making systems. My sense, based on a lot of work that we've been doing in this space over the last 5 years, is that there's an alignment on the need for this. The bilateral health agreement created an opening and a recognition that there's more work to be done, and that's not done there. So I probably went on a bit of a tangent there, and I'm probably answering a little bit of a later slide, but I'm happy at any point to talk more about DRDs at a more detailed level outside of this webinar, because I think we could suck up the rest of the time on it, I think. With that being said, I think we'll flip to the next slide. So we'll step back away from some of the conservative politics and level set where we sit right now, and the anticipated time frame that we're looking at. We have a fall economic statement that's happening next week. The House will rise shortly thereafter. It looks like the confidence motions will likely be dispensed with between now and the fall economic statement. So to Michelle's point, outside of something bizarre, it's highly reasonable that we will get through to the end of the session. And at this point, the only thing I've heard from the NDP is that they won't support any back to work legislation, and they would cause an election over that. So I think that explains why the Canada Post strike continues to go on, because the Liberals know they don't have support to end that strike, even if they wanted to. There will need to be that cabinet shuffle that Michelle referred to. It's likely that they want to wait until the new year because they'll want to come back, get a big hit for a cabinet shuffle, which, by the way, doesn't change polling numbers, but every government does it. Likely do a short prorogation, I mean, days, so that you can come back, do a throne speech, reset the government. You have in there the Trump inauguration that's going to, take up a lot of air and space and focus, and it already is. There's a health ministers meeting that was supposed to have happened that will need to be rescheduled, that was supposed to happen, but was delayed because of the Nova Scotia election. If there is prorogation, and this is only a guess, it's not assured, that means that there would be a throne speech, that would be a confidence vote, and there would be another confidence vote around the budget outside of any confidence vote that is brought forward by the opposition. There's some big things that Canada needs to be ready for in all of this. We're hosting the G7 in June, of which planning would be a year already in development. And an election could happen at any point in time on or before October 20th. But beyond October 20th, we can argue that we would have some form of stability because we would be through an election at that point in time. Next slide, please. Uh, we just wanted to flag that, and we're happy to, you'll see the slide. We just wanted to flag that the health systems across the country are in their own state of flux. There are health transformation agendas taking place in every province, leveraging the vast majority of it, their own funding outside of the funding they've gotten from the federal government in order to respond to the specific jurisdictional needs that each jurisdiction has when it comes to the health system. Some more rural and remote, some more inner city, some systems more connected than others, and all of them face their own challenges in order to transform to meet the needs of Canadians' primary care and acute care needs in 2025 and beyond. Next slide, please. We did want to flag a couple of the policy items that are currently underway, just to be aware of. And while the time in which this we have before another election is short, it doesn't mean that things are still not moving rather quickly. And there are a couple of things we can expect. We've talked about bilateral deals. We saw Alberta signed a drugs for a disease deal. I expect we'll see many more of those roll out, especially as provinces look to book that money in their out-year fiscal plans. I think we can expect some bilateral deals on pharmacare, in particular BC, where there's a memorandum of understanding that was signed before the BC election to figure out how to move that forward. That pharmacare deal would be specific to contraceptives and or diabetes. But there's some policy things that we're watching out for as well too. An interpretation letter on the Canada Health Act, the admissibility of, if I'm, and I hope I'm framing it right, but the admissibility of private pay insurance services outside of the provincial insured services, whether that's admissible, whether that's considered a user fee that is outside of the confines of the Canada Health Act. I think we can probably expect the feds to say they believe that it is outside the Canada Health Act, and what they will do about it is the news that we probably would be waiting for. That would be a big moment in time to reflect on the HHR crisis, and a moment in time for the government to put their line in the sand on a big issue. But it doesn't come without a lot of risk, because there's a lot of Canadians that are accessing healthcare that way, in part because there's a shortage of family doctors, and the market is solving for that until governments figure out a way to solve for that. It's a big debate for the federal government to wade into. On pharmacare, we're seeing a lot of activity on the expert advisory group. And then there was the letter last week that Minister Holland sent to the CDA, telling them to get working and give some advice, in particular on bulk purchasing and national formulary. We've done some analysis on this letter and what to expect. So for those of you that are clients and you haven't received that, we're more than happy to share that over with you. It's a very detailed, far more detailed direction from the federal health minister to the CDA than I think we were expecting. And it goes far beyond what was in the legislation in terms of anticipated detail. There's a lot of work that's ongoing on health research. There's a commitment for a new capstone organization that would oversee the functions of all the different governing councils, and as well as a new advisory council that would govern health research that would be chaired by the Minister of ISED. But all of this, of course, would be in collaboration with Health Canada. And there's also a lot of policy work underway. And this is more for the life sciences and health research sector as well, too, on Health Emergency Readiness Canada. What are the fundamental things and tools and processes and contracts that Canada needs to have in place to be prepared for the next, and supply chains that Canada needs to have access to and be prepared to act on in the situation that we're in, an unknown emergency, an emergency that we just don't know what it would look like right now. So how do we keep the engine warm on a bunch of transferable capabilities so that Canada is looking to respond during a crisis rather than look to sign contracts during a crisis, which is what happened last time. And the last thing I think we'd say is that the relevance of party platforms is increasing. You know, the window to influence government policy is really shrinking. Now is the time that government's out there trying to sell their accomplishments because they're trying to get support for all the great work they did, which means they're going to be looking for, and not just the Liberals, all the parties will be looking for, well, what are they going to do going forward? And that will be something you'll be thinking about all parties at the same time, not just the Liberals, especially as the relevance of policymaking in government decreases, especially in those last few months. Next slide, please. And then the only thing to say to watch out for, there are a couple pieces of legislation that are either ongoing or committed to. The Connected Care for Canadians Act is stalled in the House of Commons. There was a commitment to do a Safe Long-Term Care Act. It's not introduced. There was a commitment in the last budget to do health research legislation by this fall. That has not been introduced. There's a number of studies outside of private members' business. There's a lot of work on private members' business right now. I'm not going to walk through it all, but we'll call out there is a lot of work on the breast cancer screening guidelines, especially with the review of those by the task force. There's also an opioid crisis consultation underway right now. There's anticipated consultation and on the patent medicine pricing review board guidelines as they look to finalize those guidelines after many years of working through that. So where does this leave us? Next slide. I don't know, Michelle, maybe you want to kind of jump out. What are the things from your perspective that are really going to drive the attention of any government over the next couple months and 12 months?
Well, listen, it's not going to surprise anyone on this call that my answer is what's happening south of the border. It's going to have such a knock-on effect for whoever forms the next government, for this government during the life of it, and for the next government. And beyond tariffs, just the financial implications of the change that's coming is going to have significant consequences on what governments can invest in health. And frankly, in health research. So we know that there are a lot of researchers south of the border in the US that are worried about what Trump will do with research spending. I think we have that concern in Canada, not because of the philosophical view about health research, as much as the financial implications of some of these things going ahead. I think the number we heard this week was that Canada will have to spend $1 billion on border control. To get to 2% of defense spending for NATO is another $40 billion, double what we're spending now. So that money has to come from somewhere, and it means you're spending it on those priorities to satisfy the global pressures and not on some of the domestic things you might otherwise spend on. So I don't think we can underestimate the impact of Trump's election victory.
What about you, Tyler?
Well, maybe I'll talk about the domestic pressures. As I mentioned, the effect of inflation on Canadians over the last few years, in particular since the pandemic has affected, and the affordability issue has affected governments on many different levels. So that's going to continue to affect governments. There's going to be a push from provinces as well to continue to be able to, in their minds, repatriate dollars back to their provinces from the federal government. We know, because we talked a little bit about at the beginning of the presentation about the polling and what might happen in 2025 with the federal election. We also know that there's an Ontario election that's coming along. And I think there's been a lot of change in the way that Canadians are seeing the healthcare system and the pressure that Canadians are going to put on provincial and federal governments for transformation. I think Canadians are no longer influenced by or persuaded by the argument that we have to keep the status quo, or if not, then it's Americanized healthcare. I don't think that's where Canadians are anymore. I think Canadians are realizing that we're the only country that we know of that prohibits patients from paying for scheduled surgery. And I think there's going to be pressure on the federal government and provincial governments on how they work together to be able to deal with those challenges, those pressures that voters are going to be putting on them. Yeah, over to you, Peter.
I mean, on the last in the inertia, I think the summary here is the world is on fire. And the Canadian government will have to deal with that in some way or form. The Canadian government will have to decide how much of precious dollars that are going to continue to become constrained they will be putting into proxy wars and the rest of what's going on in the rest of the world, and how we actively contribute to global alliances, be it NATO, G7, or otherwise economic or military alliances. And that will be a very early test if the Conservatives get in before June, because they're going to be faced with a lot of these big questions really quickly, and it's going to take a lot of capacity of a new government, let alone the existing government. And then the last thing I'd say on this slide, because when we look at this and you're sitting there as a client and say, well, how am I going to navigate this? Whether you're part of the system at a different level, whether you're a external stakeholder, not for profit, whether you're somebody who's involved in manufacturing, you're all going to be implicated and impacted by all of these broader dynamics that are completely out of your control. And when you look at this and you think, well, how do I navigate this? Don't boil the ocean. That's the last place to start. You can start thinking about, well, as a government, what do you start thinking about to navigate these? What is the public policy role that a government might have, and a government will need to kind of think that through. Tariffs is a really good example, and we're starting to put a lot of thought into what might happen if Trump proceeds with a 25% tariff on Canadian products. There's probably three categories of public policy debate that a government would need to resolve to figure out what their outcome would be. And there might be more than three, but let's just for simplistic sakes say three. One, what are the retaliatory measures that a government would want to implement? And that was done in Trump's first presidency. And you saw the prime minister refer to that last night. So what are the things that United States consumers like the most that Canada can hit back with tariffs in order to pass some pain along, to force the American population to say to their executive, this is not the right approach. The second thing will be the government will have to decide what they do about the Canadian footprint, because at the end of the day, the public policy debate that the Americans are having is, how do we get more of these jobs based in the United States, not in other nations that are at the end of the day looking to access our consumer base to sell their products. So their hope is that they do this and it makes it untenable for jobs to go in other jurisdictions and everybody sets up shop in the United States. I'm probably oversimplifying it to a certain extent, but that means the Canadian government will have to respond in some way or form, both for consumers and both for participants of the economy. A lot of these costs would be passed on to consumers at the end of the day. So you would think that a government's going to say to themselves, how do we navigate the short-term pain so we don't see a massive loss in corporate Canada? But at the end of the day, they don't want to be seen to just supporting and benefiting that. That's the political calculation that a government will have to think through. And they'll have a long-term problem with, we're already in an affordability crisis. So how do we support Canadians? How do we support consumers in navigating higher costs of, frankly, everything if we're in the middle of a tariff war? So that's just one example of the thinking that a government would need to put through when they're faced with something like that. And you can take that model of thinking and apply it to pretty much anything, but it's probably a helpful moment to start with tariffs, and we can apply it to different things over time. Anything else, Michelle or Tyler, before we flip to our concluding thoughts? And maybe on the next slide, Haley, Michelle, you might want to perhaps pick out what are the big things that you were left with after this broad-based reflection we just did.
That no matter who forms government, they have significant challenges to navigate that the last Conservative government did not. So I know that we've talked a little bit about, does the past have any predictive value so that we can anticipate what might happen under a Poilievre government? But Prime Minister Harper governed at a completely different time. Tyler, sort of touched on that. So the instability of our global community is going to have such an impact, outsized impact, on the domestic decision making in the next 5 years. That will be unique to the next government. The last Conservative government certainly had to navigate some crisis files on the foreign affairs, but not to the extent that the next government will. That'll have knock-on effects for all other spending and policy decisions of the government. But it doesn't mean that there isn't an opportunity to influence those decisions. Governments will still have to set policy in health. They will still have to make investment decisions. There'll be trade-offs, But if you position your issue and your concern, I think, in a way that aligns with where the Conservative government may be going, there's huge opportunity to drive forward an agenda. These challenges doesn't mean that you can't move things forward in that environment. It just means you have to be incredibly strategic about how you do it.
What about you, Tyler? I'll pass it over there.
Well, I think something both you, Peter, and you, Michelle, talked about is the ways in which the Harper government made very strategic and focused, very narrow investments. And it is not to be cynical, but I think there are going to be ways in which, if the Conservatives are successful and they do come into government, the ways in which a Poilievre government will be looking for what's the return on investment when it comes to votes. And so that's going to, I think, come into play when they make those really strategic investments and focused investments. And the ways in which I think that conservative government is going to be focused on, even though there are going to be pressures for reducing spending, but I think in their mind, they're going to think that the way to achieve those spending, or so those reductions in spending, is going to be more involvement with the community and having more of those dollars going out to the community rather than keeping it centralized within the government. How can we provide an opportunity for someone outside of government to be doing this work and for them to be doing it for us, which is going to be interesting, because I think that's the question as well that Andre had asked in the Q&A. How can an entity remote from the operations be adequate to set policy? I don't think that a conservative government sees someone in the community as being remote. I think they're going to look for those opportunities for community actors to be more involved in the implementation of policy, but also in the setting of policy.
I might, John, answer your question that you asked here as well too, because it was a really good question around what is the basis for trusted evidence that will guide government health policy decisions. It's a great question because that will come in many different forms. And Tyler, you started answering that, or you did in some ways in your response just there proactively. Evidence for a particular government can come in many different forms. What are MPs hearing at the door? I.e., what are the needs of local communities? That's evidence. What are health system leaders locally saying to their community is some of the biggest needs that they're seeing in order to support the population health? That's evidence. I think that we need to be cautious that the way to government policy isn't by presenting a stat or two in a meeting from a national stakeholder to a minister and expecting it to get done. That will be a step. That will be a component of how you articulate a particular need for the health policy community. But it needs to be a lot more than that, so that it's clear that there is a demonstrable connection to what is happening on the ground. So I think evidence is, I would view that word broadly. I would view that word in both an academic sense, but also in a very practical sense. And I would argue that having multiple tracks of evidence that tells that story will be really important, which frankly isn't much different than what a liberal government would view as evidence as well too, with some important qualifiers that Michelle made earlier in the presentation. Michelle.
Peter, can I just add to that? Because I agree with
Please.
all of that. But I think the other thing to think about is it's not just the evidence that matters, it's the messenger. It's not just the message. So who is presenting that evidence to government matters. And that's where I think the communication strategy you have around policy and data has to be so thoughtfully considered. Because how that information makes its way to government and who presents it matters. And I know we're running out of time, but we could talk about how Poilievre has signaled that to different communities, saying, I want to hear from ordinary Canadians. He's touching not on evidence, he's touching on messenger and relevance. So I think there are different ways to take the same evidence and have it resonate in the same way, sometimes by presenting it differently.
Thanks, Michelle. Another question that came in, and we probably have time for one or two more. So if you have a question, now's the time to write it in. Um, Somebody asked a really interesting, what do we mean by fewer intrusions into healthcare? I think, not I think, I know we're trying to articulate the difference between how a conservative government and this most recent liberal government have interacted with provinces and territories, specifically on funding healthcare. Um, the vast majority of healthcare funding that went from the Harper government to provinces was through the Canada Health Transfer, the CHT, which was unrestricted dollars that the province could apply as they see fit. The Harper government reduced that escalator by that way. By that, I mean the Canada Health Transfer increased by 6% every year in order to compensate for the increased cost of delivering healthcare over time. That was done by Paul Martin. And then by the time Jim Flaherty was looking at it, that agreement went, I think, until around 2016. But a couple of years prior, Jim Flaherty and Stephen Harper were looking at it and saying, why are we increasing spending for healthcare to provinces by 6%? If on average, provinces are only increasing their healthcare budgets by about 3.2%. At the time, I was working for the health minister in Ontario, and we publicly announced that we were going to restrict growth to the healthcare budget by 2%, to try and constrain the growth of healthcare to tackle a deficit reduction at the time. So the Harper government kept to that Canada Health Transfer mechanism. By the time the Trudeau Liberals came into government, that transfer went from 6% down to 3%. The Harper government never had a year in government that the transfer wasn't 6%. So there was fiscal room for the Liberals to play with if they wanted to maintain Harper level spending. And they did that in the form of targeted bilateral health agreements that ring-fenced funding around a particular issue and also looked to get a whole bunch of information in order to track progress over time. That is how we have classified in this debate intrusion. Whether or not that's a bit of a bit of hyperbole, I'm happy to debate that, but that's specifically what we mean, is that how the Liberal government conducted business on healthcare with provinces was through a far more direct means of trying to drive outcomes. And it is likely that we will see a retrenchment to provinces managing their tasks on healthcare that they have full jurisdiction over through the Canada Health Transfer. Any closing thoughts, Michelle and Tyler, in this last 30 seconds?
Peter, just that, our team is here to support those listening and your planning efforts. And I think when I am out and about, I often hear nervousness about a change in government. I think that's natural. It happens in big moments of change, but there is always opportunity in change. And that would be the thing that I would take away from the conversation today.
Thanks, Michelle.
Words right out of my mouth, Michelle. I was going to talk about the opportunity, but a good point as well, Michelle, about, there's also, the DeSantis team is here to help with those when there is these types of changes that might be happening, and the new opportunities that do open themselves up to those involved in the healthcare system, and this amazing DeSantis team is there to help. So yeah, thank you, Michelle. Thank you, Peter, and thank you, Haley, for helping drive all the slides.
And thanks to all of you for joining, and to our entire comms team behind the scenes, Shay, Haley, Hannah, who helped make us look a lot better than I assure you we looked before our comms team got a hold on our hair, makeup, and slide design. So thanks everybody for joining. We hope you enjoyed this, and we hope to see you at the next one. Have yourself a great holiday.
Bye, everyone.